Joining us to discuss how flexible workforce of the future can add value to the NHS, please welcome to stage our speakers and session chair, Dean Royals.
Morning everyone, it's great to be here at the NHS Confederation once again. Good to meet up with friends, old and new, and great to see some faces in the audience that I recognise, so welcome. My name's Dean Royals and I'm chairing this session this morning, looking at how the flexible workforce adds value to the NHS, and we've got a panel who I'll introduce shortly, but they'll be looking at what the workforce of tomorrow looks like, how we build a flexible workforce that meets the needs of organisations, systems, patients, and of course the staff themselves. So it's fair to say that the flexible workforce has been seen something as a distress purchase. If you've been around long enough, we've used the flexible workforce when we can't get substantive staff. It's been seen, I think, for a number of years as a period that we'll go through, that at some point we'll be fully staffed and there'll be no need for bank or agency staff. Now, we know that's not true. There's a worldwide shortage of healthcare staff, and importantly, increasingly, people want to work more flexibly. NHS Professionals alone, as a large provider of bank services, has thousands of staff that only work the bank. We tend to think of people that work the bank of picking up a few extra shifts, but there's thousands of people that choose to work that way. And make no mistake, these are valuable, trained, educated, experienced staff that could go and work substantively, but they choose to work flexibly in that way. So they're here to stay as the contingent workforce. And also, from the point of view of organisations, we face that productivity challenge. How can we deploy people optimally that they're meeting the needs of patients where the patients want them, rather than moving patients to where the organisations and the staff are? So those are some of the things we're going to be looking at today through the panel. We'll also take some questions which I'll try and coordinate at the end of the time. But enough from me. Let's move over to introduce our panel. So Rosa, would you like to introduce yourself?
Good morning, I'm Rosa Waddingham. I'm the Chief Nurse and People Lead at NHS Nottingham and Nottinghamshire ICB.
And Martin.
Hello, I'm Martin Griffiths. I'm a trauma and vascular surgeon and I'm also the Clinical Director for Advanced Reaction Programme in NHS London.
Welcome, Martin. And Matthew.
Morning, I'm Matthew Coates. I'm Chief Exec of West Herts Hospitals Trust.
That's great, and thank you, all of you, for coming along this morning to the panel. I know we're in a pre-election period, so everyone will be watching their words and their P's and Q's, but let's get on with some of the questions. Rosa, you work in an integrated care system as Chief Nurse. Can you say something about how you see the flexible workforce supporting and sustaining integrated care?
So I think flexibility is really important, and often with flexibility comes portability, and what we know is going to be really important for all systems is the ability for our workforce to work across the whole system, across health, across social care, to go to where need is rather than for our patients necessarily to come to where staff are. So what we know with our bank workforce is that they're often much more flexible. They have a broad range of skills that are transferable into a variety of care settings. And as you said earlier, not in a distress way, but in a really proactive way to choose a portfolio career that sits in many areas with the security of that bank NHS framework behind them.
That's great, thank you. And in terms of, you work with NHS Professionals, what do you do sort of locally with NHS Professionals?
So I think we've been really fortunate to have some really innovative thinkers in NHS Professionals locally, helping us look at how we support care sector, for example, and certainly during the pandemic, when we had a real crisis in care staff, we used NHS Professionals and are continuing to use them to support a breadth of private providers who provide NHS services, be able to access the skill of talent and the number of people that we have available to us.
That's great, and thank you for that introduction to us. Martin, a flexible workforce, I've talked to them about a bit of a distress purchase. And my sense is they're not necessarily as valued as substantive staff. Do you think we value the flexible workforce enough?
Oh, by no means. I think that traditionally they were viewed as being a distressed purchase. People just to fill the rota and manage numbers. But I think that the skills that workforce bring, that agility of mind, that broader range of skills, that inquisitive nature, and not being stuck to that hierarchical pattern actually is a huge advantage. And having people in their organisation that have a broad range of skills, are very good at doing things different ways, approach challenges with a positive mindset, and are part of it and have a bigger view on things are really helpful in that regard. And from my perspective, it's a real bonus to have those individuals as part of our teams as we're trying to become more agile in our bigger practice.
Yeah, so you paint a lovely picture there of a sort of valued member of staff. Do you think organisations have sort of caught up with seeing them in that way as an integral part of the workforce?
I think that's a work in progress. I think that a lot of systems still have a separate equal view on what bank staff and agency staff do, and there's a difference between what bank and agency can provide to people. But I think increasingly organisations are seeing that people who have these diverse lifestyles, these portfolio careers, have that broader way of thinking, that curious style, bring passion, bring high professionalism, bring high quality of service, with the desire to actually be practically useful and help innovate, help provide challenge in that organisation. I think that organisations should be looking at more diversity to include all parts of the workforce in their practice, in their thinking.
Yeah, and see that workforce as a whole, Rosa, the sort of one workforce sort of model of sort of ICS. Can I just check with the audience, I suppose? Many of you will be working in trusts, and you'll have substantive staff and the sort of flexible workforce bank staff. Can you put your hands up if you genuinely value bank staff exactly the same way that you value your substantive staff? So there's, what, 4 or 5 hands gone up there? So there's still work to do there, I think, on there, particularly if it's sort of here to stay and people are going to be working that way, that we see them in that way.
Absolutely. I think the question is why?
Yeah.
I mean, why would you not value people who are committed to delivering that work, committed to working in those areas, committed to being flexible and agile? Yeah. And they can bring so much to your services and bring so much experience to what you can do and actually give you a different view on your practices. You should be looking at these people as being an asset rather than a burden.
Yeah. Thanks, Martin. And Matthew, NHS Professionals, you sort of provide a range of these bank services. They run collaborative banks. They provide the academy, providing education and training for people. They have the sort of the national bank where any organisation can phone up and see if NHS Professionals have got someone before you press that sort of agency key. You're the chief executive of a trust with lots of challenges, lots of opportunities in there, but also you're the chief executive of a system, collaborative system working with NHSP. What's the key to success in both those guises for you?
Thanks, Dean. Look, we're not different from many of you in the audience in trusts. Flexibility is central to our offer to staff because that's the way we're going to be able to provide high-quality healthcare into the future. And so we're delighted, I think, that we can offer flexible working to 43% of our staff at current count, and our ambitions are higher. I think that compares pretty well, but we could go further. And as you say, Dean, I think collaboration, both within the organisation and outside, is key to that. That is the success measure, or the success criteria. Look, for us, it's a bit about getting the basics right in terms of flexibility. So I'm really pleased and proud that we're able to offer self-rostering to all of our nursing areas now, at the sort of beginning of that sort of universal journey. But that's making a real difference to us. So we've seen in the 12 months to the end of last financial year, our turnover fall by 4 percentage points as a result of that and other initiatives. We're fully staffed on adult nursing with virtually no vacancies. And there's a connection with our approach to flexibility. We've started with the medical staff looking at how they can work their non-clinical sessions from elsewhere. That's very popular, and our EPR, newly installed over the last couple of years, helps us unlock people from their desks. It doesn't constrain people with having the notes. I think there's much more to come on that. I'm struck by the enormous opportunities there are for technology to make the platforms more sophisticated, more intelligent, to match supply and demand on a much more real-time and accurate basis. But all of that only ever happens, in answer to your question, if you work with others. It's a team sport, and we've got a tremendous relationship with NHS Professionals, kind of developed over many years. They're there, they literally sit just on site by where the morning staffing meeting happens, and you can see the partnership in action, and you can kind of tell that it's working. Most recently, we've used that partnership to drive improvement. I mean, the title is, what's the value? And for us, the value is, how do we make the most of our nursing resource, and how do we get the best possible services and value for money? And thanks to the efforts of our tremendous chief nurse, I'm sure I embarrass her, Kelly McGovern, who sat there, we've exploited that partnership to take it to the next level. And again, if you look at our temporary staffing spend overall, at the end of the beginning of last year as opposed to the beginning of this year, the monthly run rate was 25% less. And that's because of us working hard at our partnerships. It doesn't stop there, I don't think, for there's a pipeline for flexibility and making sure that we get the professionals of tomorrow with the skills required for tomorrow. So we're also working very hard with the University of Hertfordshire, the nursing school, the AHPs that they support us in training. So again, it's a team sport. Collaboration is the kind of name of the game, I think. And there's a final ingredient, which, apologies for abusing the time, Dean, which I just don't feel I could not say. Flexibility is part of the offer, but if you don't get the culture right, then people won't connect with it. And if you get an organisational culture that people feel that they can go with, you will provide the best healthcare. So for us, we've just launched a values-driven strategy, and we've chosen values that express what we want our organisation to be in the future and what we want our workforce to align with and connect with. So for us, an empowered workforce, compassionate workforce, a professional workforce, and an inclusive workforce. And again, I'm certain that that's part of an overall menu of ingredients that help us build a flexible workforce for the future that really does add value for our patients and the residents that we serve. So in conclusion, look, for me, it is about collaboration, but it's like strategic about the type of organisation you're trying to develop, but it's also what you do tomorrow. And for me, the self-rostering thing is the thing that we really want to drive tomorrow. Make sure that we're blending in our partners at NHS Professionals and make it better for our staff.
That's great, thank you. And that collaboration has come throughout the panel there. I'm going to open it for questions shortly, so be preparing your questions. There are some people with roving mics that I'll look out for, but just as the panel have given their first perspectives there, has anything stimulated your thoughts on something else by something somebody else has said?
So I think there's something really important about what the flexible workforce adds to the NHS, but I think it's important to remember that for many people it's a personal value add as well. It reflects a way of working that allows a greater ability to connect into different spaces, to work across a breadth of places. In my own organisation, we have a number of clinical staff who actively choose bank work as a regular addition to non-patient facing hours in their main job, to keep a whole set of nursing skills live, to use the training offer that's provided through the bank. So I think whilst we absolutely recognise the value that the flexible workforce brings for us, I do think we need to recognise for some people it's a really active choice to add value for them as well. It's not something that people do because they have to, or they couldn't get the job that they wanted, or that sort of perhaps slightly old-fashioned view of how we see bank work. It is a very active choice now for many people in how they work.
That's a really important perspective, Rose, and that's sort of portfolio careers for people and using the bank and topping up on your training and development. Anything to add?
I think just a bit around why people go into bank working. I think previously it was a Sometimes it was imposed because they didn't feel the culture was inclusive enough for certain people, certain groups, and we had a real disparity in demographics about who was and wasn't doing bank. And that might have been why people felt they were disenfranchised from being in other organisations. I think that's changing quite a lot now. And we're seeing people making that active choice rather than feeling it's something they want to do. I think the behaviours of the bank are playing back towards the bigger system. We're now seeing more of that inclusive approach, part of how we value staff differently and celebrate their individual characteristics in a much more positive way. I think that's a real bonus for everybody, and that adds to our ability to change our culture. So many people feel they're restricted by an organisational culture, a departmental culture, a ward culture that doesn't fit them. They don't fit, therefore they find themselves somewhere else to be. And if we become more flexible as a bigger system, that allows people to work to circulate that system and become more powerful in that place. I think that will help us become more flexible operationally and strategically as time progresses.
Yeah, that's a really interesting point, Martin, and that's, I suppose, a tip there for organisations in terms of sort of exploring about, you know, who your temporary workforce is, how they're made up, you know, where they come from, how they work, what they think about the sort of organisations. So let me just see if we've got any questions to give to our panel. This is a question and answer session. Here we go. There's someone right at the third row in. At the front, there's a microphone coming. Would you like to introduce yourself and give us your question?
Hi, my name's Ella. I'm here from the Nursing Times. My question is around the first NHS staff survey for bank staff, which came out last month, which found that bank staff are even more likely than their substantive colleagues to face sexual harassment, physical violence and discrimination at work. Bank nurses were among the highest groups to face this kind of violence. So my question is, what can be done to kind of ensure that bank staff and the wider flexible workforce are supported and protected while they're working?
Thanks very much, Ella. I'm not sure all the panel will have seen the survey, but I guess the sentiment there about bank staff sort of facing some of those challenges sort of coming through. Martin, do you want to start? I know you've got a role in this as well.
I have, yeah. I think, and I take your point. It's a really distressing thing to read about, not just for the individual working bank, but for the whole of the NHS. And I think it's a thing we have to consider as a whole system. I wonder if it's whether those individuals are put into those most difficult areas, or whether it's just an experience, or perhaps the way they are seen by staff or individuals as being not part of the bigger team. And I think we have to be very careful about how we approach this. From my perspective, it's about our values, about how we as a system present ourselves to our clients and to ourselves, about how we police our own behaviour, and how we make sure that we are within the best of the NHS and our values that own our society. So for me, it's about looking at the data around it, asking our bank staff what happened, how it happened, and make sure we mitigate that in practice, and making sure we celebrate them as being individuals and part of their situation. And for me, I think it's really about having a whole system view around it, recognising there is a challenge there for us all, and seeing that this is that our bank staff are probably, you know, the tip of the iceberg. I would say they are probably the canary in the coal mine. And their views, their experience is valuable to help us understand what's happening and to shape our practice that suits everybody. So it's a really useful piece of information, though albeit somewhat distressing.
Thank you. And while I give the panel just some opportunity to think there, a number of organisations have signed up to the sort of sexual safety charter, and I guess a tip for organisations on this might be about looking at that sort of bank and flexible workforce, about how they're covered in there. Do you sort of recognise the value that they add? Do you support them in the same sort of way? But
And
Matthew, Rosa?
I think it's about equity, isn't it? So for me, when you go to work as a bank member of staff, the way you're treated, both while you're working and when you report something afterwards if something happens, has to be equitable. You have to have the support. And there are you know, bank workers, there's a whole variety of ways in which people undertake bank and agency work. And I think it's beholden on us as organisations that use staff to make sure that there is that equity not only of experience but of support, of ability to access somebody who's going to listen to you, of that knowledge of our staff, of things like our sexual violence charter. If you're a bank member of staff, you're trained, you're aware, you know the same going into any environment as a substantive member of staff will. And that's variable, and we know that's variable. And some organisations, and you mentioned things like the NHSP Academy, have great training wraparound packages for their bank staff, and others don't. So I think for me, the point of equity for bank staff and that increasing of the relationship that Matthew talked about into being the norm of how we see bank staff can only help with the distressing findings that we read about in that survey.
Thank you. And Matthew, you touched on this really in your opening session about sort of values and culture. Anything to add to Ella's question?
I completely agree with what Rosa Martin have said, and I think it comes back, Dean, to your opening question, which is, are people valuing and treating their bank staff the same as they treat their permanent staff? And we should apply exactly the same standards to our bank staff that we would apply to our permanent staff, and that is what we should bake into our culture, I think.
Thank you very much. Have we got any other questions out there? There we go, just there's someone near you. If you say who you are and give us your question.
Hello, my name's Mina. I'm a pharmacist by background. I'm currently a clinical fellow in South East London ICB. My question is, we've just seen that how bank staff are not kind of viewed the same as permanent staff. How do we ensure kind of their leadership progression, you know, opportunity for a promotion is viewed the same by employers and harness, you know, those talents that actively choose to be bank staff?
Yeah, thank you. So looking about that value practical ways in terms of leadership for them, NHS Professionals, I'm sure, in terms of the management of the bank, are on stand D1 if people want to get some more sort of information from there. But any perspectives from the panel about sort of valuing that way? Matthew?
Look, what a great question. And look, I think that's a big part of the next chapter. And how do we ensure that as we integrate and treat bank staff the same as, and apply the same standards, as I was saying, how do we make sure they've got access to opportunities? And it's complicated because, of course, they're working for a different employer in contractual terms, and yet they're in your environment. So I think it's complicated. I think a step's been taken in the right direction by NHS Professionals in doing that, but there's work to do, I think, between providers and kind of bank providers as well as our own internal staff. So a really good observation, I thought.
Thank you, Matthew. And Rosa, I mean, as a nurse, and that importance of sort of CPD and professional development.
And it's difficult, isn't it? Because as we've heard, there's an employment challenge. I think the best way we can make sure that that's a possibility for the future, so that people who choose bank as a way of life, if you like, rather than as an add-on, have the training, the skills, the opportunity to access things like Chief Nurse Fellowships in your trust, the opportunity to access training beyond mandatory and core training, are really important things for those opportunities as we reform and look at flexibility across all grades of our nursing workforce, that people are there and ready to move forward. So I think the job for today is access to training, access to opportunities, access to insights. The job for tomorrow is how we make that a possibility.
Thank you. And Martin, anything to add?
Yeah, I think there's an attitudinal issue about where you come from when you're applying for these more senior roles, and there's a view that bank staff are some way less valued and less purposeful in their actions, and we have to think more about competence and experience rather than working in a certain fixed area. I think that broad range of skills and credentialing is really important, and I think that employers have to think about potential, when you've seen someone's out there, what they have actually done, what they can do, what they bring to the situation. And I think that those people who have had the bravery to work in a broader sense, acquire those skills themselves and become credentialed, actually have much more of an asset to individuals who might come from a more traditional and safer path. So I think if you're employing for people to do things that are going to be more adventurous, more curious, more about challenging norms, you would look at this group as a positive asset.
Thanks, Martin. And I guess there's something, isn't there, in a world of integrated care where we're trying to integrate care, you know, what it says on the tin, that sort of recognising the value of the workforce that may have worked in a variety of different settings becomes ever more important in that way. We've got another, there's one over on the far side over there. There's a microphone coming to you. And again, if you'd like to introduce yourself and give us your question. Thank you.
Hello, my name is Helen Taylor. I am the Healthcare Coordinator at the Carbon Literacy Project based here in Manchester. How can we ensure that the flexible workforce have access to the right climate education training and sustainability training that is needed to support the NHS to achieve its net zero targets, given that the climate crisis is a health crisis, and we all need to work towards net zero?
Thank you. And I guess there's something beyond the sort of flexible workforce in that question as well, but the sort of right skills and competencies. Anyone want to make a start on that one? Rosa?
Well, so I think there's a really there's two questions in there for me. There's a question about how we make sure our flexible workforce is skilled up, and I think they are, and I think that ability to move across sectors really helps. So when I look at the changing behaviour around glove usage, very much happening in our care sector, and some real innovation then being brought back into hospital trusts where people are talking about how we work differently. Bank staff who are really flexible, who work across multiple settings, have a real opportunity to cross-pollinate thinking. They have a real opportunity to take best practice examples, to test them out in other areas, to start the conversation. So I think there's something about an added benefit of a flexible workforce. But there is that bit that we've talked about in the last couple of questions about what we have for our substantive staff has to be reflected in what we offer and supporting our flexible workforce. And that includes things that focus particularly on the net zero work as well as everything else. So I don't want to talk about the bigger question, but I think in terms of that flexible workforce, that there is a benefit we could harness.
Thank you. And again, to the question, it may be worth popping in at D1 and asking NHS Professionals about the academy and the sort of training curriculum and what they offer, and any suggestions I'm sure will be welcomed by staff on the panel there. Anybody else want to add anything to that? Okay. Martin?
I think if anybody is a cursory look at the NHS Professionals website, see how net zero is baked into the culture and values and the training of what's provided to their staff. And I think they're in the way they're actually leaders in that piece around it. And I think that's very strongly evidenced in practice, in training, etc. I think there's something that we are hopefully to support that in that leadership. And I think that from my experience, I think the staff in that area are more focused on that. They're more interested in that. They're more concerned about that. They're more prepared to call that sort of thing out. And for me, it's an opportunity for us to learn together. So for me, I know this organisation are committed to this process, both strategically and operationally. We're seeing that in our practice, and we see that day to day on the wards that I work on.
That's great. Thank you, Martin. And I'm going to make a chair's mistake here now by saying I think we've got time for one more question, because I know we're up against it. So you might get a brief answer, sir, but can you just bring the microphone? Gentleman in the middle of about aisle row 8 or 9 there. Thank you.
Hello, I'm Ben from The Doctor magazine. From locum doctors we speak to, a lot of them want to work flexibly because of the issues with demand on their jobs when they're permanent. So how much are flexible working patterns a reaction to the burnout and the poor conditions faced by doctors and nurses throughout the NHS, rather than a proactive thing that has been done without that, as opposed to in reaction to that?
Thank you, Ben. Martin, I don't know if you want to come in on that one, but I guess the question is, are people choosing flexible because they don't feel valued again? But
I think it's a difficult question to answer, but I do value it. And I think choosing to go into a situation where you've got security in that place can be beneficial. I recognise that individuals find that they're enabled to compartmentalise their activity, gives them a bit of more space to think and to act more purposefully. From my perspective, I think that we value our less than full-time staff, and we bake it into our training to make sure people have that capacity to do so. When we do that as part of our organisation, we see the benefits of that and how our individuals perform and work within teams. I think this work, again, it's a positive choice. And I think that I recognise that some individuals will use this as a distress moment, but that's probably because we aren't putting them in the right place in that organisation. I think for us, it's incumbent upon us as part of a bigger system to make sure that our junior colleagues and our senior colleagues are supported, and then they have the opportunity to report and get the help that they need. So I think that, yes, there's definitely a point in there, but I think looking at how we support full-time staff, both inside the bank and in the NHS itself, there's definitely a cause for optimism, in my opinion.
That's great. Thank you, Martin. And on optimistic note, can I thank everyone for attending this session. I know there's another session starting straight after this. It's been great to see everyone here today. We hope you enjoyed the rest of the Confederation and all that it's got to offer, but could you thank the panel in the usual way? Thanks very much, everyone. Thank you.